Colon chats breaking the walls down. Deep conversation, sharing it all. Prevention and care is the heart of the scene. With Kyra's courage keeping us keen.
Hello, everyone, and welcome to Colon Chats, a video series that's really dedicated to demystifying and destigmatizing colorectal cancer, the treatment, as well as survivorship. And today we have with me Nurse Delia Lewis. Welcome, Nurse Lewis.
Thank you for having me.
And I would ask for you to share with our viewers and listeners a little bit about who you are, what your exact role is in this profession, and how did you get involved in this journey?
First off, well, this is new for me. It sort of fell in my lap because of where I worked initially. I started off in a private institution, and got into it as a favor to one of the doctors that I worked with, lovely gentleman. And yeah, it's not a snowball from there.
Yes. So you sort of specialize a little bit now in ostomy care, correct?
For want of a better word, I do believe so. But it's not that I'm a specialist. I'm just a little bit more in tune and aware of what the need is, and I take it seriously. Maybe because of how I was brought up, even though my father used to say you don't know about a subject or whatever, you learn it. I was not always proficient in the area. It's something that I learned as I went along, and because it was necessary. Before that, before getting into nursing, as I should say, I was in teaching, so it's a totally different ballgame.
So we would have met after my colostomy surgery. So I had to
Mm-hmm.
get a defunctioning colostomy as part of my treatment plan for
Mm-hmm.
my stage 3 rectal cancer diagnosis. It was actually the
Mm-hmm.
first thing that was done. That was my first surgery, and even before doing chemotherapy and radiation therapy.
Right.
And the reason for that was because of the size of my tumor. It was so big that not even the colonoscopy scope could have passed by, so it had like a very small space remaining. And so both the surgeon, Dr. Weissing, and my oncologist, Dr. Bagalu, they agreed that the best course of action would for me to get that colostomy to prevent any sort of blockages or eventually perforation as the treatment journey continues and the colon gets inflamed and there's edema and those sorts of things.
Uh-huh.
So after that surgery, you were, actually before the surgery, you were the first person that I called so that once I would have gotten out of the hospital after the surgery, that I would have had that care at home to help me take care of this new reality of mine, this stoma. And, just for our listeners' benefit, would you be able to describe, what a colostomy is and then also what is the stoma specifically?
So the colon itself is redirected and brought out to the surface, and it now sits on the skin. So it essentially where the stool will now come out. It's just a whole other direction as opposed to down. It's now coming outside. So it's a little bit daunting for patients, I must say. Not a little, a lot. Can be very daunting.
The way that I put it is you're having your insides on the outside, right? It's like you're looking down every day and seeing your intestine and what is typically inside of your body, you actually see it on the outside. So that in itself is an adjustment.
Yes,
Then I mean, I know, like, for example, for my mom, she was completely afraid of it in the beginning. She didn't want to see it, she didn't want to touch it. And so,
yeah.
how do you then come in and help patients take care of their stoma?
The objective is really to get you comfortable, well, as comfortable as you can be, because it is really something you have to set your mind up for. It's just that we have to make minor adjustments. And that's what I like to call it. It's a minor adjustment because we just have to get settled enough so that we know what we're doing. And my job was really to get you settled. But for the most part, I think you went into it with a very open mind, which is very crucial. You were ready to deal with it. You did your research and you came into it ready to do what was necessary to get you back out there. I mean, we had some challenges initially, and then we figured it out, and of course, you just ran with it. So that's my job, really, to get you up and running. You know.
Yeah. So for me, I wanted to have Nurse Lewis involved once there was stitches. Like I didn't want to have to deal with the stitches and caring for, stitches because, there's always the risk of infection. So once
Uh-huh.
the stitches were healed and fell off, then is when I decided, okay, it's time to take off the training wheels. And she actually started training me to clean and care for the stomach on my own so that she would have to be coming to me every 5 days. Right? And so, in that vein, can you explain to us what is proper ostomy or stoma care? Like, firstly, what are the products that are needed? Because people hear about it and they think, oh, is the bag, is the bag. Well, firstly, I like to call it the pouch, a little bit more refined. It's a pouch. But it's not
Uh-huh.
just the pouch alone that is needed to properly care for your stomach. So, can you give us a little bit of insight into the range of products that were necessary and products that you would have used on me as well?
It's very vast now, and it's very, it's diverse, and there are many options. So we start with a single unit for you initially, which is just the bag alone. And then we moved on to a double appliance, which would have been much easier for you to maintain and keep clean. We have removal wipes, we have sprays, we have all sorts of things. And it is a process. I like to use normal saline. It is sterile and it's a way to keep everything nice and clean. We don't want to put anything too harsh there because it is part of the inside of the body and germs can still track in, bearing in mind it's stool or whatever. But we still have to keep the area clean. So I like to use that. I haven't deviated from that and I don't plan to. I guess people who have stomas say, oh, well, we wash it with soap and water. I don't subscribe to that at all. Because for one, it may be too harsh and some people can get irritations. So we try to keep it as simple as possible for you. Yes, there are varying types of removal wipes, and it does help to keep the skin nice and clean. It helps to get rid of all the residues from the adhesives and stuff. And it also is much easier to take the bag off as opposed to just ripping it off the skin, which can traumatize the area. So that is something that we employed with you. We also had our prep and we had our hydrofilm dressing, which I like because if there's any blistering on the skin, it helps to keep that area nice and sterile once we apply the bath. And then, of course, you had your paste and powders and all like that. We do have steps to follow. So it's not just a willy-nilly kind of thing. And I really don't like when people say it's just a bag or, oh, you just need a bag. No, you don't. Every patient is different. Every outcome is different. So it will never be a one size fit all kind of situation. So you have to know exactly what you're dealing with. I often tell people don't run off and buy a whole bunch of things because it's very expensive, number one, and what you get may not be conducive to you. So I try to dissuade them from doing that so that they don't waste money and time.
If we give people a picture of what I use so that they have an example, but of course, preface it by saying,
Mhm.
consult your ostomy nurse first to find out what are the products and the sizes and the types of products that are suitable for you.
Mhm.
And so just
Definitely.
to go down the list of items that we use. So you mentioned firstly the saline, and that is important for, cleaning up the, whatever stool remnants would be around on the stoma, on
Yeah.
the skin around the stoma. Definitely gauze. So the saline goes with gauze. You need to have gloves as well. That's preferred. To
Definitely.
again
It's
keep things
preferable.
sterile. Right. So far we have gloves, saline, and gauze. Right. And then when we go to the actual ostomy specific products, we would have the pouch. And as you mentioned, I would have used in the beginning a single pouch, which is attached directly to your skin. But then
Mhm.
there's also the two piece, which has the flange, I think is what it's called.
It's
Uh,
grand, yeah. Or
and
wafer,
that
whichever
attaches
one
to
you're
your
comfortable or you remember.
yeah, and that attaches to your skin specifically, and then the bag is clasped onto that.
Yeah. Yeah.
So that's the 2-piece. And that one, it's for a little bit when you're more comfortable and you're able to take it off and take it on and change
Mm-hmm.
the bags on your own, right? The pouches, sorry, on your own. And so then when we get into like the skincare, you spoke about the adhesive remover. So instead of just ripping the pouch off of your stomach, you take this adhesive remover, you dab it around the places where the glue is there, and it helps it to be removed or
Yeah.
loosens it before it comes off of the skin, right? When we're getting ready to put back on the pouch, you have the skin barrier, which is either a spray or a little
Wipe.
wipe that you wipe around, and you put that everywhere where, glue essentially or the adhesive from the pouch is going to be stuck to your skin. Yes. And then we also use a little powder.
It really helps with the redness. Yeah, the skin is irritated. The stoma powder does help to soothe it. And you would have felt the difference between when we started to after we applied the powder, that it really does calm the skin and it
Yeah.
takes away that redness and irritation.
Yes. And then now there is the cleaning of the pouch while it's on, so that when you pass through, it's not just there building up, building up, building up. What I used based on your recommendation was the saline, spraying it into the bag itself as opposed to
Uh-huh.
using harsh, regular tap water. Spray it into the bag. So it
Yeah.
helps remove and clean and cleanse the bag a little bit between,
Uh-huh.
passing stools, so that you don't
Yeah.
you're not walking around with a dirty bag all the time, and that it doesn't stay, and the stool actually irritates the skin
Exactly.
and the stoma itself. So in order to keep the pouch clean between actual changes, utilize the saline within the pouch to clean it out. And then there's also little deodorizers as well that you can put into the
That's right.
pouch itself to maintain a fresh smell as you go across your daily activities between actually changing out the
It
pouch.
also
Yeah.
helps to remove this. It also helps the food to come out easier because it's not a little lubrication in there. So it helps to keep the bag essentially or the stool in flowing properly.
Yeah. And so we mentioned all of these products, right? Now, this was 2 years ago when I had this journey, and it was difficult for me to get all of these products here in Trinidad. Amazon was my best friend. Is it still that difficult 2 years later?
Yeah, there are, I think, one or two companies here that do have a few items, but they don't have everything. So you still have to look to outsource materials.
I mean, I guess this will be a public service announcement to medical supply stores to start bringing them in, because there are more and more
Definitely.
patients that have colostomies and ileostomies in Trinidad
Yeah,
and Tobago.
yeah,
And they need this care, they need these items to ensure that they have an easier journey with this stoma, because poor stoma care leads to irritation. And I think that also is what leads to people staying away from doing it and not wanting to do it when the doctor recommends that they need to get one, because they hear so many
mm-hmm.
horror stories, or they
Our
hear about
story, that's right.
friends and family members who would have had a hard time, or
Mm-hmm.
in extreme cases where the skin breaks down, and it's really bad, and it's because they don't have the proper products
Yeah.
to be able to take care of these tumor. Yeah.
I mean, it's not ideal when this happens, but it can be fixed. Yeah, I have encountered two situations where we had to work and prep and change out a little more often just to ensure that the skin has time to heal and regroup. And it does take a little more work, but it is doable once you know what you're about. And you have to, how to put it? The objective is really to get the patient back to a level of normalcy. So we have to work around their schedule and their um treatments and all those things. We do have people who have gone back out to work with these things even before their treatment was over. Some of them have opted to keep it, which is admirable. So there is nothing wrong with having a stoma per se. It is just having the knowledge with how to go about caring for it. That is important. And once you're comfortable, I don't see any reason why you can't get back out there.
Yeah. I mean, I think that's a good point that you raised. So, in my situation, my stoma was reversed after 14 months.
Uh-huh.
But there are people who are currently living with their colostomy permanently. And so I think it's important for us to reiterate that it's not necessarily a major impediment, especially when it's done with a long term or done on a long term basis. The surgeons would put things in place to ensure that it's, a little bit more secure than something that is
Mhm.
temporary and ensure that you have a pretty decent quality of life moving forward. Do you know of any patients who, are currently living with their colostomy for the rest of their life?
Yeah, yeah, definitely. I still see a couple of them. There's one gentleman within 3 weeks of seeing him, when I first got him, he had some major issues. We worked that out. And within 3 weeks of my visiting, I saw him driving. I was like, this is amazing, So he's having fun. He's living his life. And I commended him for that. He opted to keep it. He's perfectly fine. He travels, he swims, he goes he works outside of the on the field, I should say. And he knows how to manage himself quite well.
Right. And so that's one of the myths that I guess we need to debunk, that once you have a colostomy, that your life is over and you're confined to your house.
Oh no, definitely not. Definitely not.
Yeah. And now that, as time progresses and people are getting more aware of it, they're actually creating more, little add-ons and tools for people to use. So there are swimming pouches, etc., that would allow you to go swimming as usual. There are different sizes of pouches to be able to allow you to have different types of activities. And as you said, people travel with it, they fly, they do, their regular life. It's just, a little bit of an adjustment. And in most cases, people don't know that you might be sitting down next to somebody who has a colostomy or an ileostomy.
Precisely. And that's the
Yeah.
objective, to get you comfortable enough to be yourself so that you just do what you have to do. You go about your daily life and nobody the wiser. Unless you
Yeah.
say to them, well, hey, this is what it is. But I don't see a reason why people should be afraid of it. Yes, it's daunting at first because you need help. But once you have good support, and I think that is very important, it's not only the patient, it's the relatives as well. I try to help them understand what the situation is and what you have to do, because eating habits are going to have to change a little bit until we get settled. You have to figure things out. Some things are off limit, but for the most part, once everything heals over nicely, you are free to eat, you know? But the family is important because you really, really do need support in a time like that, or at a time like that, I should say. Sorry. And it does help to get you going. It does help to get you going.
Yeah. I think something important as well for us to speak about is the whole mental and psychological side of it.
Mm-hmm.
As you mentioned, it is daunting at the beginning, and it could remain a very daunting task for a lot of people as they, kind of get into the mentality of it's a major impediment. And then also, not every journey is the same. Not every journey is going to be easy. Like, the person that you mentioned, within 3 weeks, they were driving, etc. Like, for
Yeah.
example, in my case, I couldn't drive because personally, I would have had a stoma that was a little bit larger. It started to protrude and it never went back in the
We
way that
did,
it was supposed to, or stay in, I
yeah,
should
we
say.
did encounter some problems with that.
Yeah, a lot of complications. And so I didn't drive, and there were certain physical things that I couldn't do. Like I couldn't bend over and tie my shoes and put on my socks and those kind of things. So there are realities of situations where it doesn't always go very well, but it's also not essentially horrible, right? And so I guess for me, part of the coping mechanism that subconsciously I came up with was naming the stoma. And so I think both of us came up with the name Buddy Barker for the stoma. And so like we would, sort of personify him and give him different, I guess, human-like qualities, because sometimes I would be sitting down there speaking with people and it would make a noise. And then I would go, oh, it's Buddy just trying to be a part of the conversation, as opposed to, being embarrassed, like, oh my gosh, they're hearing something going on. So is just making a little bit of fun and light of it, and kind of incorporating that aspect into it as part of like a coping mechanism. So have you seen that sort of thing happening with other patients, or what suggestions do you have for other patients who may be going through a difficult
Yeah,
time?
some of them have actually come up with names, which is quite very prudent. They because they was like, okay, it's here. So what am I going to do about it? I can't be it's there. I can't move without it. I can't exist without it. So what am I going to do? Ignore it? So no, it's become part of them with an extension. And one person said to me, only when you're here, this thing has anything to see. She says, I think he likes you. So,
I can attest to that. Sleep whole week, silence, nothing. As soon as nurse reach, oh, oh.
so yeah, as I think naming it gets them comfortable. So they build a little relationship, and you can tell eventually when things are happening. You feel the movement, you feel the gas coming, you feel the stool, you get to understand what is actually happening. Because we go about our daily routine and not realizing, well, okay, this is what this is, and we don't feel anything. But with that, you become a little bit more sensitive. So, when you eat, you actually feel the stomach undulating a little bit, which we call peristalsis, and then your things happen. So you become more aware, I should say, of what is actually happening with you as a person or happening within the body. Things that we're not normally because
Yeah,
everything is locked.
yeah, and I actually think that it was sort of a little bit of a blessing in disguise because it made me more acutely aware of, like you said, what's actually happening inside of our bodies. And I mean, we just go
Mhm.
about our daily lives just taking it for granted that our body is doing what our body is supposed to do, right?
Yeah.
And not realizing sometimes the stress that we put our digestive system under when we eat certain things. Now, when you have
Mhm.
a stoma, you know exactly what you eat, how it affects you, because sometimes it's fine. And then other times it like your stomach is angry,
Yeah.
right? Because of the reaction that it has to certain types of food that you eat. And it
Yeah.
gives you a little bit of an insight into what is sort of helpful for your digestion system and then
Mhm.
some things that are not so helpful. Right. And so as we're on the topic of digestion and nutrition, let's talk a little bit about the nutrition while you have a stomach and how that differs from, a regular or healthy human being who doesn't have a stoma.
I don't think it should differ that much. However, we need to be mindful of what we put in across the board because too much of one thing is good for nothing. It's really saying from time immemorial. So we have to be mindful that we don't want to overdo. When you eat, it's to be satisfied, not to be overfull. So with that being said, when you come out of surgery, we start with just fluids and soft diets and we take it slowly so that we reintroduce solid food back into the system. Reason for that is everything goes to sleep. So you don't want to end up with essentially food piling up on top of food that has not been digested. So we start with liquids and we progress until we can tolerate solid food. For the keeper with ileostomy, duty foods are a bit of a challenge because things are not totally digested in that from that aspect of the stomach, that area I should say. You can't really have food because it comes out. You literally see it coming out. And it can cause a lot of irritation and it makes the bag fall off. Or the whole setup, it will detach from the skin. People with colostomy can get away because the food is more thoroughly digested and it comes out as a regular bowel movement. So you want to eat properly. You want to have your fibers. You want to have your fluid. You want to have not too many heavily um, greasy and meat, too many meats and things like that. Normal diet on as much as we could tolerate after your initial stages. have passed. So we will take it slowly. Once you're feeling okay and we don't have any bloating, we don't have any pain, we don't have any vomiting, we don't have things like that, we proceed to add things onto the diet as we go along. For people with the ileostomies, we try to avoid fruits with skin because it's not digested and because it's so close to the stomach, it will block up. So we try to stay away from that. But essentially, for the most part, you're able to eat a fairly normal diet with regards to either one of them. You just have to modify a little bit.
For my case specifically, I was told to have a low residue diet.
Mhm.
And that
Mhm.
is, like you said, no fruits with skin or pulp, no vegetables with a lot of roughage and fiber in it because
Mhm.
it would cause, that sort of block to happen because it would be really hard to get it out with unaided, essentially. So really low residue, no set of fiber, lots of, starches and liquids specifically so that it would be easy to pass and I don't have any, stress,
Hang-ups, yeah. Mhm.
yeah, to get things out. So in as much as, people always talk about colon health, you needing lots of fiber to have a good, healthy, functioning colon. That's great when you have a healthy, functioning colon. But when you have a tumor or when you have a colostomy, sometimes that fiber might actually be detrimental to you. And you need to limit the amount that you put in.
Yeah. As I said, too much of one thing is good for nothing. Yes, we can be healthy, but you can't really overdo it. Taking in fiber is one thing, but if you're not having the fluid enough to keep the fiber soft and bulk, it will not work. It will just stay there and it won't be able to move. So you have to be mindful of all these things. Even with somebody who does not have a stoma, you really don't want to overdo fiber unless you're actually staying hydrated. Because essentially, water is reabsorbed in the colon. So if you're taking in a lot of fiber, it's going to be, when it gets dry, what is going to happen? It's going to get stuck. So you have to keep in mind all of these things as uh, that is how it works. You just don't put fiber in and say, okay, I'm taking fiber. So no, you have to be hydrated. Fiber needs fluid water. And as I said, water gets reabsorbed from the colon. So you have to make sure that you're hydrated enough to keep it moving.
Yeah, definitely. And in terms of, as again we're talking about, the mental load of, having a colostomy or even having a colorectal cancer diagnosis. How do
Mhm.
you interact with your patients? And one, what do you share with them and their caretakers to help them along this journey and help them understand, what their bodies are going through during the grueling treatment of colorectal cancer?
For one, I try to get the their headspace. Before I do anything else, I need them to have a clear mind. So we talk about that. I ask them first off, tell me what is going on in your head. Let me know how you feel. I am not just here to change a bag. You will have questions, you will have concerns, you will have fears, you will have doubts, you have all sorts of things. So I have to deal with that first before I can do anything else. With the relatives, it's the same thing. Tell me what your concerns are, and we deal with that. And as we go along, they get comfortable enough to say to me, okay, no, I noticed this, no, I noticed that. When we eat spicy foods, I get this reaction, or I get. So you kind of get them to the point where they are comfortable talking. It's a relationship. Yes, we may not be friends, but we have that respect. And for me, the mental space is where I need to start because it's not only about as I said, changing a bag. I have to make sure that the patient understands that okay, we are in a transitional phase. We are moving from one thing to the other, and we are going to encounter. We may not encounter that. We may encounter setbacks with medication. You're going to find something you're not coping well.
And what do you do as a nurse? Because, I mean, you're not just an ostomy nurse. You have, regular regular duties as well, and you're dealing with a number of patients with differing ailments, and then you
Uh-huh.
come and you have to deal one-on-one with cancer patients specifically. And to be honest, some of them may not survive after you've even built a deep connection and relationship with them. So how do you as an individual maintain a positive outlook and be able to continuously open up yourself to your patients?
It is something that I have had to work on because of the fact that, yes, I know this is my job and I encounter patients every day because I am a general, I'm a registered nurse. So I see patients who are sick. But when you have patients that you come into contact with constantly on a regular basis, you build a rapport with them. It's a bit difficult to detach at times because of the relationship that we may have had. Yes, I have a few of them, and one or two of them did hit me really hard. So it is a bit of a challenge sometimes. But as I said, I think it because God has a plan that I don't know about. And I told him, I said, this is what I need to do. And if you think that I need to do this, well, then you will help me figure it out. You will help me through this because there are days when I see them, I can't show what I'm thinking or I can't show how I feel because I know what's coming. I just have to, you know, keep it together, as it were. And there are things that patients would have divulged to me that I don't keep to the relatives. And then, of course,
Mm-hmm.
the unthinkable happens. But I know, so I talk with them and we reason together and I see, I would give them the assurance that, okay, this is what it is and it's fine. It is okay. As hard as it is to come to terms with that, it is okay. Sometimes there are things you just can't. Medical is a very dynamic thing, and even though we have tried, and we still try to make sure that everybody is okay, there are just some things you just can't. And communicating into that sometimes it is really hard.
My oncologist, Dr. Baglu, I asked him the same question. And, he indicated similarly to what you just said. And then he also went on to say that sometimes for them, it's not only the survivors or surviving cancers or win, but in the event where, patients are in palliative care, the win there is ensuring that you were able to contribute to them having a peaceful passing and for them to be able to have a certain level of dignity and quality of life before they pass. Yeah. And so, as we even continue to have that conversation around relationships with patients, I know you mentioned before that patients could call you when they have any issues. And I mean, I could attest to that as well. I've called you quite a number of times. Let's talk about some of the issues that may come up with the actual stoma itself that warrants people calling someone and not trying to take care of it on their own.
Some of the things that if patients have had breakdown of the skin, it may not be that would have seen them from the inception. I would have been contacted afterward and have would have had to go in and try to troubleshoot my way around and make sure that things are working. So I would check in to say, okay, how are we doing today? What have you noticed? Is there any changes there? How do you feel? Um, so I usually check up on people that I deal with. And of course, as I go through it, um, with some people with treatment, some of them will see some bleeding. Sometimes they might have some irritation. The stomach might swell. They may have, you know, even from eating something, they may have constipation. So we would have to figure out, okay, what we had for dinner or what did we have for the last 2 days or whatever it is. They may have vomiting. What did you do? Okay, let's try this, let's try that. Stay away from this. We try to get at a later point in time and see if that is actually the cause. So, I try to figure out what happened so that we don't run into a similar problem. Once everything is okay, you're free to go about your business and have your fun go. hang out with the family, go, like as I said, go to the beach, go take a swim. Nothing is wrong with that. It's just that you have your little minor things to take care of, and you're okay. You're okay.
And then, so as we speak about having it only for 14 months, I did the reversal surgery. And I guess people might have the misconception that once it's reversed, immediately you go back to normal. Immediately you start back eating all the things that you wanted to eat before, but that is not the case. It takes, a period for your body to readjust. So let's just talk a little bit about once the resection happens, what that looks like in terms of care for yourself, for your body, and then giving yourself enough time for your, internal wounds to heal.
So people think once the teachers outside have fallen away, everything is hunky dory. That is not the case. Remember, it's in depth. They're going through 7 layers of your anatomy to get to that point in the first place. So you're going to have stitches for each of those, essentially. The next thing is it's similar to when you would have gone to sleep in the first day. You're now back at square one. So you have to start slowly, as you mentioned before. So you'll go through the same process again. You're starting with our fluid, we're thickening it up, and then we're going soft diet, and we gradually introduce other things. Some people are fine for the most part, and some people have a chronic diarrhea after resection. Those things happen because we have lost a lot of good bacteria in the gut, so we have to try and put those things back in. So the diet has to be geared towards that. As simple as possible, and we try to keep it nice and light. We don't want to overstress the system, and we use our pain meds to manage whatever, if it's necessary, of course. But the diet is what is a key is key.
As we look to close this episode, I would like for you to share anything that you would want to share with our viewers and our listeners as it relates to, destigmatizing the colostomy. And then also in terms of colorectal cancer care and awareness, what are some of the key points that you'd want to drive home to persons who may be currently going through treatment, as well as persons who are supporting others who are going through treatment?
I think that one of the more important things is for people to not ignore their body. If you realize or recognize that there are signs something is wrong, go and get it checked. Don't sit there and assume, oh, okay, I have constipation, or oh, okay, I just have cramps in the stomach. And not every time your stomach is gonna run to the doctor. But there are signals to tell you, well, okay, something is wrong. You will see a difference. Don't just, leave it to chance. Find out about your family history. Because there would have been things, and long time they would hide a lot of things from us because they didn't want everybody to know. But now it's because things were there from generations before and we weren't aware of it. So you find that people are now discovering, oh, well, my grandmother had this, or my great grandmother had that, or my grandfather had. So if you find that you're feeling unwell or you're noticing changes in your body or with eating or starting stool or whatever it is, get it checked. There's nothing wrong with going to the doctor for a checkup. I advise it, but because I'm in medicine, oftentimes you see people coming with things that could have been avoided simply by getting themselves checked out. Um, for the ones that already have gone through it and are going through it, it's fine. That is life. Everybody has something to deal with in one way, form, or fashion, and it is up to you to be comfortable enough in your own skin. And I think that is part of the problem. And it's not just the physical body, it helps to heal the mind. And half of the healing, or 90% of your healing, starts in your mind. So that's why I told you I deal with the patient's mental state. That is where I go in. I deal with your mental state. So let's see where your head is at, and we will take it from there.
Yeah, definitely. I 100% attest to that. Create a little positive bubble. I mean, there is
Yeah,
something called toxic positivity. We don't want people that just saying, "Oh yes, everything is great, everything is great, everything is great." No, it's being
no,
realistic, but then staying
exactly.
positive and understanding the different aspects of this battle, because it is a battle and it's a journey that you're
Mhm,
going through, and you're going to have
mhm.
to fight, but you're going to need to maintain a positive outlook. So you're looking towards something that is the positive outcome of beating this. And even if you're in a scenario where, it's not a positive outlook, maybe it's terminal, again, it's still all about making peace with where you are, what you've
Where
done,
you are.
and
Yeah,
exactly, and with the reason that, you're here and what is your purpose in this moment as you are, transitioning in life. And I mean, at the end of the day, I concur 100% with you in terms of keeping people with negative energy at bay, because they're going to disrupt your aura, your flow, and your mental state. And what
mhm,
you need for this journey is to be able to be present and stay in a state of mind that and enhances your outlook on how things are going, and to be able to be a positive influence on others in your life too, because in as much as you're going through this journey, people are also looking at how you're going through this journey, and it also helps them be able to cope with whatever is happening to you. So your friends, your family members, they're looking to you for cues if they're going to fall down and fall apart, or if they're going to stand strong with you. Yeah. So thank you so much, Nurse Delia Lewis, for this really insightful conversation. I am grateful to have had you as my ostomy nurse. I'm grateful to have you now within my life as a very dear friend. And I really hope that we are able to continue advocating and sharing and destigmatizing colorectal cancer as well as ostomy care, because it is something that is essential as a part of the colorectal cancer journey, and for
yeah,
other digestive issues that may not be cancer related, but this is also a part of the treatment plan and treatment journey.
yeah, definitely.
Yes, so thank you so much, and I do hope to speak
You're
to you again
welcome.
soon, and so our audience to be able to get some more knowledge and wisdom from you as you continue along your journey doing this amazing, amazing work, caring for patients and making our lives a little bit easier as we go along this journey. So thank you so
You're
much.
welcome. I do hope it will help.
Colon chats break